Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country. Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible.
Welcome to another episode of Native Bidaské. I'm Levi Rickert, editor and publisher of Native News Online. And we have a special guest today to talk about some changes made to the Medicare's ACO reach. And it's actually the Centers for Medicare and Medicaid Services recently announced a coordinated set of changes to the Accountable Care Organization Realizing Equity, Access, in Community Health, also known as ACO REACH. So that model started in the performance year of 2024. And with us today as a special guest is Craig Parker, who's a CEO of Guideway Care. Welcome to Native Bidaské, Craig.
Hi, Levi. Really nice to see you. Thanks for having me today.
Hey, it's my pleasure. And first of all, tell our viewers what Guideway Care is and what you're all about.
So Guideway Care is a company that was founded through research done at the University of Alabama at Birmingham. And the research was really focused on trying to help under-resourced persons, personhood, patienthood, personhood. We live our lives as persons. Occasionally we become patients. We all want to become persons again. That's why we access the healthcare system. But the healthcare journey can be confusing, especially for under-resourced persons or people who don't have a clinician in their family. Guideway was formed to come alongside those patients to help them sort of translate between their life and the instructions they're receiving from the clinical team so that they have the best opportunity to get to their best outcome.
Okay, great. Now, as I mentioned earlier, that these changes will take place in the performance year 2024. When is that? Is that January 1? When is exactly the performance year begin?
Yeah, Levi. So ACO REACH was started in 2023, and after it was designed by Medicare to be a 4-year program. Midway through this first year, Medicare has solicited comments from participants and asked how things were going. And in response to comments from participants, as well as a desire to drive some deeper interaction in other areas, Medicare has announced changes. And the changes will take effect January 1st, this coming January, and will apply for the next 3 years.
Okay, now does this include, when we say Medicare, lumped in there, does that include Medicaid as well?
It does.
Okay.
So the terminology that the United States federal government uses for this are dual eligible patients. So patients who are eligible for both Medicare and Medicaid, they're all covered by the ACO REACH program when the doctors choose to participate.
Okay. So in layman terms, so that the average consumer can readily understand, what are the significant changes that will take place January 1?
Well, there are some technical changes in reimbursement and payments and financial models between the government and the physician practices. And those changes are pretty technical and probably not very interesting to most of your viewership. The changes that are really important and that I think are most exciting are the changes around health equity. So when the model was first started, this is the government's effort to reward physicians for taking holistic care of patients. So it's focused primarily on primary care. And when the model was first started, people who the government classifies the entire population into segments. lowest 10%, middle, all the way up to the top 10% in terms of wealth and access. When the ACO program first started, it only gave physicians a premium, a large premium, a $30 per month premium for the patients or members in the lowest 10% of income and access. And what the government realized midway through this first year is it needed to provide more incentives to physicians to do deeper interaction and engagement with more of those under-resourced categories. So the program is expanding from the 10% now 30% of qualifying patients, their physicians will get a bonus payment.
So really it's an attempt to, when you speak about health equity in Native News Online, we've done a lot of stories about the disparities that have existed in Indian country versus Native Americans versus their white counterparts. And some of the numbers are actually pretty horrendous. So this program is trying to bring it all together and rectify that. Is that correct?
Absolutely. So CMS, Center for Medicare and Medicaid Services, is working really hard to emphasize equity, health equity. And for them, the way they define health equity is every person should have an opportunity to get to their best health. So if you don't have access to screening services, or you don't have access to perinatal care, or you don't have access to pulmonologists, there's no way you're going to achieve your best possible outcome. So ACO REACH, the second part of the changes, remember we talked about the first part of the changes are really technical in terms of payment models and physician requirements. The second part of the changes are all around health equity. And so the idea is, how can we incent providers to increase equity and then actually go interact with patients about things other than just clinical symptoms, right? Clinical symptoms, if you look at Medicare and people like Kaiser have done surveys, and they of all of the factors that contribute to a person's overall health and well-being, only about 20% is clinical care. 80% is related to factors outside the clinical environment. So housing, transportation, culture, personal choices. Of course, personal choices require education. If you tell someone they have to follow a low sodium diet and you don't teach them how to read a nutrition label, then you shouldn't be surprised that they don't achieve their best possible outcome. So ACO REACH is rewarding physicians for being more holistic in how they interact with their patients and do things to improve access and understanding.
Okay. And then, in the announcement, there was a term that was mentioned was integration of care guidance, integration of care guidance. Can you break that down for us? What does that really mean so our audience understands that?
Yeah. So you hear two terms in the social determinants or health equity space a lot. You hear case management and you hear care coordination. And they're not interchangeable. They actually mean different things. Case management is managing a patient's specific condition. So say you have a patient that has COPD. Case management is trying to help that patient manage their COPD disease over a long period of time. Care coordination is designed, it talks about helping patients manage everything they need to do in an episode. So before you go to the doctor, have you gotten your labs done or blood work done? Or does the doctor have access to your previous x-rays or CAT scans? So care coordination is really focused on an episode. Case management is focused on long-term disease management, but it's focused on one disease, and care coordination is focused on one episode. And there's this kind of world in between. So a person who has 2 or more conditions doesn't really fall in the case management side, and they have ongoing, they don't have a single care episode, they have these multiple care episodes. Care guidance is designed to bridge that gap. So how can you help a patient manage their healthcare journey across multiple diseases, multiple appointments over many weeks or months or even a year?
Thank you to our platinum sponsor, the American Dental Association.
And then help me understand this too, because when you're talking about the episodes, and sometimes, especially some people have multiple issues happening, and sometimes doctors prescribe, one doctor prescribes one medication, the other is prescribing another one. And how do they coordinate that? Is that case management or coordination so that they're not overdosing or over-prescribing might be the better word, so they don't overdose? Can you explain that for us?
Yeah, so at its fundamental level, that is a care coordination a problem, right? So someone has to serve as the connective tissue to allow the physician to know everything that's gone on with that patient. Mm-hmm. A primary care physician, your general practitioner, is really the best person to be the quarterback for your overall healthcare journey. Mm-hmm. So ACO REACH rewards primary care physicians for serving that vital role and for being much more proactive. So primary care physicians in an ACO model are rewarded for improving attendance with annual wellness visits and screenings. And when you do screenings and you send someone to a specialist, the primary care physician is now incented to get the data back. So the primary care physician, with the incentive to reduce the patient's overall cost of care, right? Nobody likes going to the doctor. So the primary care physician is trying to take better care of the patient in a preventative way. And one of the ways they do that is by making sure they understand everything that's going on with the patient.
See, I really like that, because I just know even people in my own family that have had situations where it doesn't look like there's a lot of coordination taking place. And you know, as I mentioned, you can overprescribe before you know it. And it's not just for Native Americans, for anybody. And so I really like where the approach. And, you know,
can I interrupt you there? Because there's something really, really important in overdosing or care coordination. What our data show across multiple populations, but especially in under-resourced populations, including Native American populations, patients have a reluctance to bother their nurse or their doctor with a question. They're very busy. I'm sure this will be okay. I'm just going to keep doing what I'm doing, when a simple telephone call could provide a lot of clarification. Mm-hmm. So care guidance is designed to give them a peer where they can have a decompressed conversation, so they don't feel like they're intruding on a nurse's valuable time. They're talking to a peer. And what we find is in those conversations, we find symptoms that might indicate some clinical complication or clinical need. And the peer, the care guide, is able to say to the patient, hey, let's work with your primary care physician to get more information and understanding about this.
Mm-hmm. And I think that is just so important. I mean, yeah. And I kind of like the way you said that. And I think the message really is, don't be afraid to call. Sometimes maybe people put so much faith in their doctors or trust them so much that they're just, okay, he prescribed, it must be what I should be taking. And sometimes adverse things happen. And so the important thing is stay in communication. I really like that.
Even if the doctor hasn't made a mistake, something else may have changed in our bodies, right?
Yes.
So the right medication today might not be the right medication a month from today. And so in this case, an ounce of prevention is worth a pound of cure, because what happens when you don't ask that easy question? Your symptoms deteriorate and you can end up in the emergency room. Whereas if you'd made a call and said to the nurse, hey, I'm not sure about this, the nurse may say, come in and let us see you. It's a much better experience for everyone compared to an unplanned visit to the emergency room.
Well, Craig, you've broken this down really nicely for us. I know when I read some of the material, it read like an insurance policy. and I don't care how educated you are. Sometimes those are tough to unravel, but you've really helped us with this. So is there anything else you want to comment on before we let you go?
Yeah, I would say this. Health equity, the government is working hard to increase equity, which is the opportunity to achieve your best health. But we all, as persons and patients, have an obligation to play a role, right? A doctor can't make us better. A nurse can't help us with our symptoms if we're not interacting. So communicate, right? It's that. Guideway is built around helping patients communicate better, understand better. Your doctor wants to help you, and ACO Reach is about helping doctors want to help you holistically. But if you're not talking to your doctor, you're not going to reach, you're not going to take advantage of that opportunity for your best outcome.
Well, thank you so much. And to our viewers, thank you for tuning in Chimigwich to another edition of Native Bidaské. We'll be back next week with more informative information and how to live healthier lives and work together as a prosperous community. Chimigwich again.
Levi, thank you very much. Really enjoyed having the time with you.
You're welcome.
Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible. If you appreciate what we do here at Native News Online, we invite you to donate to support our continued work covering Indian country. You can scan this code with your smartphone or go to the link located below this video to donate today. We greatly appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to scan this code or go to the link below to subscribe to our newsletter. Thank you for joining us today, and please be sure to join us again next week for another episode of Native Bidaské. Chimigwech.